One of the objectives for the upcoming lab is to differentiate right from left disarticulated bones. LabTutor indicates for you which right-left bone pairs you'll need to know for the practical exam. In this tutorial, we'll use the bones of the forearm, the radius, and the ulna as two examples. First, we'll look at the articulated bones to see the bone markings and the articulations between the bones. And then we'll look at disarticulated bones and demonstrate how to use these markings we saw in the skeleton to differentiate right and left bones. First, let's take a look at the bone markings of the radius. At the proximal end, the radius has a disc-shaped or circular head. So when you see that circular head, think radius. The head of the radius articulates with the capitulum of the humerus. The radius then has a narrow neck and the radial tuberosity on the anterior side. And that anterior radial tuberosity is the attachment point for the biceps brachii muscle. For the ulna, at the proximal end, you can see the U-shaped trochlear notch. So when you see this U shape, you should think ulna. The trochlear notch articulates with the trochlea of the humerus. Posterior to the trochlear notch, you can see the olecranon process, which is the bump of your elbow. Now on the distal ends of both bones, we can see that both the radius and the ulna each have a styloid process, which is a thin pointed feature. So this is the styloid process of the radius, and this is the styloid process of the ulna. If you palpate your wrist, you can feel the styloid processes. The styloid process of the ulna is on the side of your pinky finger, and the styloid process of the radius is on the side of your thumb. Okay, if you were to see one of these bones on a practical exam, how would you tell right from left? One of the easiest ways to make these determinations is to use the landmarks on your own body. During the practical exams, you will be able to pick up and handle the bones. So for the radius, first you're going to start in anatomic position. So you need to make sure your palm is facing forward. Then place the head of the radius at your elbow and face the radial tuberosity anterior. Think about how your biceps brachii attaches on the anterior aspect of the arm. Then line up the styloid process with your thumb. If the styloid process lines up with the thumb of your right hand, it's the right radius, and vice versa for the left. For the ulna, you should also start at anatomic position with the palm facing up. First, place the trochlear notch facing up at the hinge joint of your elbow. Then line up the styloid process with your pinky finger. If the styloid process lines up with the pinky of your right hand, it's the right ulna, and vice versa for the left hand. You can use a similar approach to determine other right-left bones in the lab. Think about how these bones articulate in the skeleton, how muscles attach to the bone markings, and see if you can palpate some of the bone markings on your own body. If you have any other great tips for right-left bone determination, please share them on the discussion board this week.